What's amazing is so many cancer patients, when they're diagnosed and they're told they need chemotherapy, almost all of them don't want to do it. Instinctively, they don't want to do it. They don't want to be poisoned. They don't want to suffer. They don't want to get sicker. But everyone tells them they have to. And so they reluctantly agree to do it. And for most of them, it doesn't end well. They get a treatment or a series of treatments, and there will be a very short window of time where the doctors can't find any tumors. And so they'll say, you're in remission, you're cancer-free, yay, right? We see celebrity headlines all the time. I'm cancer-free now after having a tumor cut off, right? But the truth is, you're not cancer-free. You still have cancer cells in your body, you still have a sick body, you still have a depleted immune system, and it's just a matter of time before new tumors form. And it's really sad to watch cancer patients go through this process of, oh, I'm in remission, and they think everything's great and they can go back to normal life. And a few months later they have another scan and there's a new spot or several, or it's migrated from what started as a tiny lump in one breast is now in their brain, in their liver, spots on their bones, in their lungs. And we know that's from the chemotherapy. It's causing it to spread, it's making it more aggressive, and it's causing secondary cancers in the body.
Yeah, that was my next question is, do you think that it's related to the chemotherapy?
Yeah, we know it is because of the industry studies tell us that chemotherapy is carcinogenic, it causes secondary cancers. There are many chemotherapy drugs that are known carcinogens and listed by the U.S. National Toxicology Board as carcinogens. They cause cancer.
Let's hear. In other words, you're saying that, and this is, specifically in the treatment of cancer here I'm talking about, conventional methods of treating cancer, which would be the chemo and the radiation and the surgery, they're really the equivalent of taking a hammer and smashing the check engine light or taking a carpet and covering up the manure, but they haven't really solved the problem, they've just covered up the symptom.
Absolutely. In fact, Patrick Quillen, who wrote Beating Cancer with Nutrition, a very good friend of mine, in his book says that 42 to 46% of cancer patients die of cachexia, of malnutrition. How many oncologists are addressing malnutrition? No one. In fact, what do? They give people Ensure, which is sugar, and you know that cancer is an obligate glucose metabolizer. It needs sugar to survive. In fact, one of the techniques is to reduce the amount of sugar so that it can't feed the cancer. But they're actually giving gasoline to the fire and then expecting to put out the fire. You can't put out a fire with gasoline. So that's 42 to 46%. Now if you look at other statistics, what does a cancer patient actually die of? They usually end up dying from some type of an opportunistic infection, pneumonia, whatever, urinary tract infection, becomes septic, whatever. They also die of multi-organ system failure because the tumor burden is so great, the system can't keep up, the entire blood disgraces that result from this. So really, when you look at it, cancer has never really killed anybody. It's the sequela of cancer, it's the consequences of cancer that actually kill people.
It doesn't make sense to poison and to radiate and to cut a body that's already sick in the first place. People don't get sick because they have cancer. They're already sick and then they develop cancer. So if you start trying to poison and put these horrific things into a person's body that's already weak and sick in the first place, you're not going to get very good results. And statistics show us that. A study done in Australia at the University of Sydney, Australia, where they looked at 22 different cancers over a 5-year period, and they found only a 2.2% on average success rate with chemotherapy. Those aren't very good odds. If you cut out an organ, if it's diseased, what are you telling that patient to prevent that from happening again? And so the traditional methods of treatment is just not working.
Dr. Veronique Desaulniers, who cured her own breast cancer naturally, just told us that chemo has a 2.1% success rate when we're looking at 5-year survival. That's unbelievable. I wanted to visit Webster Kerr, also known as the cancer tutor, so I wanted to see what he had to say about the same topic. So I caught a flight one early Saturday morning to Kansas City. In your opinion, talk about the wisdom of using chemotherapy to treat cancer. Is there a place for chemotherapy?
Well, let me put it this way. I work with a lot of cancer patients who are still using chemotherapy. What I will tell them is, before you go in there, we'll take some MSM, methylsulfonomethane. And some of that MSM will turn into DMSO, and MSM by itself will open the ports of the cancer cells. And some of it will turn into DMSO, and DMSO opens the ports of the cancer cells even better. So a little bit of that cancer chemotherapy will target the cancer cells. So It's kind of to make chemotherapy a little bit more effective. But the damage is done because they use doses that are very high. And so it kills a lot of good cells, and it doesn't target the cancer cells. As you may know, the 5-year cure rate for chemotherapy, radiation, and surgery is about 2.1%. And if you took non-Hodgkin's lymphoma out, it would be less than that. NHL and Hodgkin's disease are really the only two kinds of cancers that do respond fairly well to chemotherapy. But most of the major types of cancer do not respond well to chemotherapy at all.
Unfortunately, in the Western world right now, almost all medical systems, whether it be Canada, Europe, America, our doctors are only allowed to do chemo, radiation, and surgery when it comes to treating cancer patients. And we know that chemotherapy does not work for stem cells, the cancer stem cells. We know radiation makes the cancer stem cells worse. So I don't know why either one of those would be used. Surgery could be used on occasion if there's something blocking maybe an artery or a passageway. But in general, most cancers can be taken care of holistically without having to use surgery either. Personally, I would never use chemo, radiation, or surgery for myself or my family. I've done too much research, and I've just seen I see the people die in front of me. People get cancer, they do chemo, radiation, surgery. Hardly ever works.
What's amazing is so many cancer